Hi, and thank you for joining us for our very special edition of Ask a Kid Doc. As you may be aware, we did have a previous episode that we wanted to bring to you about finding a pediatrician, but we have a very timely and sensitive matter on our hands with the novel coronavirus. So we are joined here today with our expert, Dr. Levent. She will be explaining and answering all of our burning questions on the coronavirus. Just to let you know, this is not a live event. However, you are able to still answer your questions down below, and we will do our best to get back to you in a very timely manner. But with all that being said, Dr. Levent, can you go ahead and introduce yourself to your viewers?
Sure. I'm one of the pediatric infectious disease doctors here at Advent Health for Children.
Awesome. So most importantly, moms like myself, we want to know, what is COVID-19?
COVID-19 is the novel coronavirus that was defined in 2019. That's why it's called COVID-19. It is one of the coronaviruses that wasn't there before, but it is very similar to MERS or SARS that was seen before. One of the big problems about this virus is nobody really has any previous antibodies since this is new. And it wasn't there before, but it is similar to the previous ones.
Okay, so with COVID-19, I think a lot of people have questions on symptoms. People wonder, do they have it? So can you just explain to us what symptoms come about with COVID-19?
Sure. Most of the time you're going to have a mild cough, but sometimes you can have mild, moderate to severe symptoms. The big three symptoms that they're talking about is fever, cough, and shortness of breath. So that's, if you have all three, that is very concerning for COVID-19. It can also cause bronchitis, and sometimes it can go to severe pneumonia as well.
Got it. So even with some of the symptoms that you've described, it sounds like it could also be allergies. I've never had allergies ever, and I went to Central Care a couple weeks ago because I'm like, oh my gosh, I have like shortness of breath, I'm coughing, and it was allergies. So
right.
How do those symptoms differ?
And that's actually a great question, because you can have many other things, including other viral infections. We are seeing still the flu in the community. We have rhinovirus, enterovirus, adenovirus, and of course allergies in this area is quite bad in this time of year. So how do you recognize that this is COVID-19 versus others? And of course, we are going to help you to recognize. Your pediatrician will be helping you to recognize all of that. But mostly, if you have had contact with someone who has had COVID-19 or traveled to an endemic area, those are the higher risk ones. And if you have had that history with the fever, cough, and shortness of breath, then you're at higher risk to be screened.
Got it. And it may be concerning for some of our viewers. I know it's a concern for me as a parent, thinking, what if my child doesn't have symptoms? Is that a possibility?
Yes, that is a possibility. We know that kids have milder symptoms than adults, and they might have a very mild cough, very mild, fevers or low-grade fevers with some fatigue. And sometimes it is known that they might not even have anything to tell them that they have the COVID-19. Because of that, knowing your contacts and the travel history is very important. So if you have someone in the family, for example, who tests positive for COVID-19, then probably the whole family has to be checked.
Wow. Now, in the unfortunate event that someone does have COVID-19, are there any treatments?
So there are some treatments, however, that's going to be spared for the very sick and severe cases. Most of the COVID-19, especially in kids, are going to be just taken care of by supportive care like any other viral illness. However, if you are having any severe symptoms, definitely you need to be evaluated and sometimes maybe admitted for further evaluation and treatment.
Okay, so if they feel like they have the symptoms and want to get checked out, what are some of those resources or areas that you recommend them go to?
So definitely having information from their pediatrician's office will be a great place to start. But also, I know Advent Health has a great phone number which will be provided later that they can ask questions through. And I know that they are working on the application that you might be able to communicate with an application through Advent Health. So starting there will be great. I know some of the Centra Cares are going to be available for the checking and evaluation. And of course, if you have severe cases, going to the ED or emergency department will be appropriate.
Okay. And this might sound like a silly question, but if I'm thinking it, I know someone else is too. Does the flu shot prevent you from having or from contracting the coronavirus?
So having a flu shot will protect you from having the flu. And it is the seasonal flu that we have been still seeing around. It's slowed down a little bit, however, it would not protect you from getting COVID-19. The vaccination efforts have been going on, and I know they started the human trials, but it is still very early to have the vaccine for COVID-19. So I would continue to vaccinate your children against the flu if you haven't gotten one, because it's still going around. It is still a really important information to have, and it is an important infection that can still cause severe infections. So I would continue that, but that would not protect you against COVID-19.
Got it. So learning so much today. So thank you so much, Dr. Levent. Thinking about like my child, how I have a daughter, she's 5. I mentioned her several times before. She has questions about everything. So as a parent, I want to be able to help answer those questions. We don't want the virus to be a bad word in the house, but we want to be able to help answer, those questions that they have. So what's the best way I can explain the virus to her, the coronavirus? I shouldn't say the virus all the time. The coronavirus to her without scaring her.
And of course, it is really important to give them the facts and not scaring them. It is an interesting time that we're all going through. And I know with your daughter, you're experiencing it. With my 3 kids, I'm going through the same thing. So they are coming back to trusted sources, which in the house, I'm the trusted source, even if they're reading online and trying to get information. It's good to have a trusted resource. Your pediatricians are definitely good trusted resources. CDC and WHO, those are the great resources that you can just get updated information. So what I'm telling them is really prevention is the best important thing that you need to be doing. Of course, washing your hands with soap and water is the most important thing, especially after you go to the bathroom, before you eat, or anytime your hands are soiled, to wash your hands appropriately with soap and water, and doing it long enough, which 2 times happy birthday song is supposed to be 15 to 20 seconds is the best. So also using a hand sanitizer as much as possible whenever your hands are not soiled is great, important thing. And then of course cleaning the surfaces. Maybe you can get them help you out with cleaning surfaces, because this virus can stay on surfaces for a long time. So cleaning all of that, cleaning their toys might be a good thing to start with. So of course giving them the facts and not necessarily going through scary news, and just staying with the family, telling them that you're there for them to take care of them, and you're just there, you're just staying home to spend a little bit good time with the family, but also trying to get best information would be great.
I love that. So you mentioned lots of great things. At home we do wet your hands first, and then we make sure we sing happy birthday twice. My daughter before was just going straight in and just like putting soap and then like rinsing her hands off. I'm like, that's not doing anything. But she is actually the one that comes home and tells me like, hey, don't touch your hand, or don't touch your eyes, don't touch your mouth, and when you open the door, use your butt to open the door. And I'm like, oh my gosh, I can't wait to talk to you about all these things, because I want to make sure like we're being relevant, we're being timely with our children, and of course we're not scaring them on any information that we're providing them. So,
and I know hand washing seems to be a very basic thing, but it is very, very important. And of course, it is known that we touch our faces and our eyes, and if you've touched a person that may have coughed the virus, touch the surface, and then you touch your eyes and mouth, definitely you can contract the virus. So it is very, very important to continue to wash your hands and then use the hand sanitizers and wait long enough so that it dries out before you touch anything. And before you eat is really important too, because you're just probably having that contact. And of course, trying to be as safe as possible, stay home, and trying to avoid contact with others, especially if somebody's sick, is really important.
Just using not to touch your face, I'm sure at some point during this conversation I've touched my face like 3 times. But when you say stay home, it's spring break, it's really hard, is it safe to go outside? Is it safe to go to the park?
And that's actually a great question, because we're going through the same thing. So my kids are dying to go out every day. So we try to spend good time. So we're reading books, we're watching movies, we're baking together, you know, cooking together, making sure that everybody has time for maybe studying a little bit. But I think it is safe to go outside in the fresh air. We have beautiful weather right now. So we're doing some maybe community walks and trying to stay away from people. So social distancing is really, really important. Staying away about at least 6 feet from people. And just, this is not only to protect yourself, also to protect others in the community as well, because if you have the virus and you have mild symptoms, you don't want to give it to others as well. So that's why I think it is very important to stay away from crowds. However, if you're in a smaller group, you can do some picnics or just little walks in the area, so that way you're not out of your mind at home. Yes. So it is important to do that, and we can do it, thanks God, in this area. There are some places the weather is not as good, so you have to stay home. But I think being careful and being very wary of your surroundings is really important.
I love that, because there's been so many cancellations in the area for different reasons. I'm a runner. My marathon was canceled. My daughter, she's supposed to do Smile Mall, that was canceled. But I love the fact about still getting outside. We did our own little virtual run last night, you know, just me and her. So it was really great. So I love that with the fresh air.
Right.
That you can do that.
You can do that, but just please be careful and not get into too many crowds. And don't stay away from people. That's good for you and for the community as well.
No, that's awesome. I want to go back to something else that you touched on, was about disinfecting and helping the kids like spray. So how often should we be disinfecting like toys and clothes?
It's actually on a regular basis, I would say. If you have anybody who's coughing on them, of course you need to do a little bit more. If they're soiled, you need to do more. But just as you're doing any time in your regular home, it wouldn't be more than that. But maybe once a day, or you know, once every other day should be okay. But if you have anything soiled, of course, cleaning it. It's just very standard precautions.
Got it. So my 5-year-old, she loves to wash and clean, so maybe that's a game that we can do, is put all the toys inside of the tub and scrub them all down, right?
Exactly.
That's awesome. So we talked a little bit about washing hands, and you talked about before eating. How can we get children who may not always want to wash there's always one that's really stubborn, they do not want to wash their hands or hand sanitizers. Is there any entertaining way? You have any tips or tricks there?
Yes, you have to be creative. But of course, I think if you talk to them about how important it is to protect themselves, and how important it is to protect others as well, and just make it fun. Make it as fun as possible. You know, we talked about using Happy Birthday song. You can use any other song, about 15 to 20 seconds, and maybe just getting, you know, good soaps that can just make them feel good, you know, smell good smells. Yeah. So you have to be creative, but I think you have to be talking about the facts, how it is very important to protect themselves and others.
Perfect. Now we have a couple more questions I want to ask you before we wrap everything up. You talked about social distancing. So does that really help our children and ourselves like not get the coronavirus?
That actually is shown to help with the contact with other people. It might help to contract the virus from others, but also will protect others from contracting if you have anything as well. So it is actually shown to be very effective. And right now, I think all over the world, we're finding out staying home and staying away from people makes everything a little bit easier. And we know that our hospitals are going to get very overwhelmed in the next couple of days to weeks. And to keep that under the curve, as we talk about, so not to overwhelm our systems, we need to be very, very careful of making sure that we stay home and we stay away from people.
Perfect. So in addition to social distancing, what about face masks? Should our children be wearing face masks if they leave the house? Is that going to help them at all to prevent getting the coronavirus?
I recommend not to use, and I think our authorities are recommending not to use face masks unless you're sick. If you're healthy, it is not shown to protect you from getting the coronavirus or any other viruses. But if you are sick, if you want to put a mask on to protect others, that would be fine. But just hand washing is the best way, and just staying away from people are the best ways to protect yourself.
Awesome. Thank you again, Dr. Levent, just for all your expertise when it comes to this timely and very sensitive matter. If you're tuning in with us, you can watch this episode on askakiddoc.com later and any of our previous episodes. And just to let you know, any links or anything that we brought up in the conversation today, we will absolutely have that posted for you. But just to make sure that you have the most relevant and up-to-date information, you can stay up to date with us at coronavirussignsandsymptoms.com. You can also contact the Advent Health Coronavirus information line at 877-VIRUS-HQ, which is 877-847-8747. Thank you again for tuning in with us. Thank you, Dr. Levent.
Thank you so much for having me. I
You're
appreciate it.
welcome. We look forward to seeing you next time.
Thanks.